May I, Your Honor?
Yes.
Thank you. Your Honor, I would like to have published what is in evidence is 201A, and then I'm going to proceed after that with 201E.
Okay.
Dr. Russell, I have up this exhibit, and with regard to the questions of Attorney Brennan that he just asked about these alleged shards, can you tell the size of them from this depiction?
I don't even see any shards in that depiction.
Can you read that slide and see the handwriting that is there?
Yeah, it looks like clear app plastic collected from 7/18/18. There's another date over to the left side, and then it says AMV 6/29/23.
Right. And if Mr. Wolk, you could go back, can you determine at all from this whether the shards are microscopic or not?
I cannot see any shards.
All right, let's go to 201E. With regard to this depiction, do you recognize what is in this depiction?
It looks like irregular, red-colored pieces of debris.
Thank you. And do you recognize the ruler above those pieces?
I'm not sure if this is the same ruler as in the previous image, but there does appear to be a ruler.
If we could go back to the previous slide, does that at all assist you in determining whether or not it's the same ruler?
Not exactly, but there are similarities.
So let's go back to, flip back to the next slide. Does the, what is up in black help you reach any conclusion about whether those pieces are microscopic in size or not?
Well, so those are, again, I'd like to go back, but I think those might be 16th or 32nd of an inch if we're using the same edge of the ruler. Those pieces that are depicted are not microscopic because we can see them with our eyes, but they're extremely small.
All right, so they're extremely small. You've asked, you want to go look back at the ruler. Does that further assist you in your analysis as to the size of these pieces?
16, so those looks like they're maybe a 16th of an inch or less.
Okay, so let's go back, Mr. Wolf, one more time. So these pieces are a 16th of an inch or less, correct?
Yes, if we're using the same ruler.
Right. So with regard to, and if we could, Mr. Wolf, now go to Exhibit 1. Attorney Brennan asked you several questions with regard to whether those 16th of an inch or less pieces could cause these types of abrasions. You have addressed this issue, but I would like you to answer whether those pieces, 16-inch or less, could cause, now knowing the size, whether they could cause these abrasions, including with regard to this pattern.
I don't believe so.
And with regard to that answer, how do you come to that conclusion? What is your thought process?
Okay, again, there are multiple parallel abrasions. So these pieces would need to be lined up in a certain configuration to cause those abrasions, and they'd have to be oriented in nearly the same direction because many of these groupings of wounds, and if I may use the pointer, are oriented in this direction a little bit, well, anatomically a little inferior to superior, ever so slightly this way. So they're oriented in the same way. So not only would they, those abrasions are rather large for those tiny pieces of plastic or glass, but they'd have to be oriented in a certain way to cause those wounds.
As an emergency department physician, as a forensic pathologist, what is the likelihood, if any, that those shards could cause those wounds?
You have to ask it differently, Mr. Wilson.
Dr. Russell, please state your evaluation and conclusion and the basis for it as to whether those shards of glass, shards of plastic, 1/16 of an inch and less, can cause those abrasions on and wounds on the right arm of Mr. O'Keefe.
I do not believe that they could have caused those wounds.
Is that a close call for you to come to that conclusion?
Not at all.
You were asked several questions by, please keep that depiction up, Mr. Wolf. You were asked numerous questions by Attorney Brennan where he wanted you to go section by section by section and evaluate each. He grouped these, I think, 5 or 6. Do you recall that questioning?
Yes.
Is that a scientifically proper way to evaluate this wound to determine whether or not it is from a dog? Is that a proper methodology to look at each individual section only?
No.
How, at a scale, is it improper to evaluate them that way under your methodology?
Sustained.
Dr. Russell, what is the proper way to evaluate the wounds on the right arm to determine whether or not they're caused from a dog?
To look at patterns, because individual wounds can vary, but the pattern is what is significant.
And on your direct examination, did you go through this method that you just described, a pattern and pattern recognition? Did you go through that in some detail and discuss that?
Yes.
Now, you were asked questions by Attorney Brennan, and in his questions, it was asserted that you don't have a standard, a published standard. Do you recall that questioning?
I'm going to allow it.
Do you recall the question asking whether you had a standard to reference for your methodology? Do you recall that questioning?
In reference to dog bite wounds, yes.
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 And with regard to the question and assertion in the question with regard to a methodology, you referenced studies and as part of your answer. Do you recall that discussion with Mr. Brennan?
Yes.
Do those, are those studies peer reviewed?
Yes.
And give the name, please, again, that we had gone over on direct, but give the name of the lead authors of each of those studies.
Yes. So one of them was by Dr. D. Munich, and the other one was Dr. Pollock. And by peer review, that means that the article was reviewed by other physicians in those respective specialties of the authors.
I'm sorry to interrupt you, Doctor.
I'm sorry. The specialties of the authors, yes.
We could take that down for a moment. Your Honor, may I approach, please?
Okay.
If I could have, Your Honor, for Madam Court Reporter, exhibits marked for identification PPP and QQQ. And I'll start with PPP if I could, please. Thank you, Madam Court Reporter. May I present PPP to it? Thank you, Your Honor. Dr. Russell, you have before you PPP. Is that the study with the lead author, Dr. Demunick?
Yes.
Do you recall Attorney Brennan in his questioning asserting that you had no basis and there was no support for your methodology of pattern recognition? Do you recall that discussion?
Sustained, your call.
Do you recall questioning on the cross-examination by Attorney Brennan as to your basis for a methodology in terms of pattern recognition with regard to dog wounds? Do you recall that?
Yes.
Can you please take a look at Exhibit PPP for identification and identify whether there's any section in that study that talks about and documents the methodology that you used in that study?
Yes. So this is an article that was published in the International Journal of Legal Medicine, and it is entitled Forensic Approach of Fatal Dog Attacks, a Case Report and a Literature Review. And so it's several pages long, talks about a specific case, and then on page 298, there are some significant passages that I would like to read, actually. So it says here, dogs have some very specific dental and maxillofacial features. They have 42 teeth, 20 in the upper jaw, 22 in the lower. Usually the mandibular dental arch is narrower and shorter than the maxilla, and that means upper, lower and upper. Maxilla is the upper. Maxilla, and the shape of the dental arches varies among the different breeds. There are natural gaps between the teeth that are attenuated or accentuated depending on the breed. The canine masseter pterygoid complex is short and strong, and its insertion on the mandible provides powerful mechanical advantage. So that's talking about the muscles, how powerful they are. And then goes on to measure the forces.
If you could find the location, if there's any in there with regard to pattern, is there any discussion about attributes and patterns in that study?
It's this next paragraph. The above features attribute to the characteristics of dog bites. The maxillary teeth distal to the mandibular teeth allow the so-called scissor bite in which the dog can lock onto his prey. The tremendous force of the bite, muscle complex can develop, allows the dog to twist and tear, and cause great damage. The injuries caused involve a combination of biting, crushing, tearing that results in characteristic patterns of punctures, lacerations, avulsions of the skin and soft tissue. Forensic pathologists noted the multiple torn wounds with adjacent puncture wounds, the so-called hole and tear combination. That's in this case. The puncture wound, a round hole, is made by the canine tooth of either the upper or lower jaw on one side that serves as an anchorage, while the other teeth cut into the flesh, causing stretching lacerations in the process of biting, shaking, and tearing. This should be considered pathognomonic for dog bites, especially when accompanied by tissue defects and claw marks, the latter being narrow, superficial, linear abrasions arranged parallel to one another, 4 or 5 in number, and usually found in the vicinity of the bite. This pattern allows differential diagnosis with bites of other animals, which are not accompanied by pulling and shaking, nor by the usage of prominent canine, and with stab wounds caused by sharp instruments.
Does that study support or not support in the literature a pattern recognition methodology?
That's sustained.
What do you conclude from the language you just read in that study with regard to methodology of discerning dog bite wounds?
That pattern recognition is very important.
Now what I would like, if I could approach Your Honor,
Okay.
if I could return this to Madam Clerk Reporter and please request Exhibit QQQ for identification. Thank you, Madam Clerk Reporter. May I hand it to the witness?
Yes.
Thank you, Your Honor. I've now handed you what is marked for identification as Exhibit QQQ. I would ask, please, that you, is that the Pollock study that you referenced in your direct and in your cross-examination?
Yes.
Could you please, as you did with the Munich study, can you please articulate the relevant, just the relevant sections with regard to your reliance upon that study?
Yes. So this is an article from the Institute of Forensic Medicine at the University of Vienna.
Is that a peer-reviewed study?
Yes.
Please continue.
Excuse me?
Please continue.
Okay. The title of the article is Fatal Dog Bite Injuries. And there's a summary. It says the dog's front teeth. So let me preface this. This was talking about a deceased child, and they described the features. It says the dog's front teeth left marks of individual circular or scratch-like abrasions, as well as slit-like skin severances. Slit-like skin severances of the skin, arranged in curved lines. The pattern of the skin lesions largely corresponded to the anatomy of the dog's set of teeth. No tissue defects could be detected.
And is there any other section of that study that references pattern and pattern recognition methodology? Any other
Yes.
words, any other section? And if so, could you please read them?
Yes. So on page 491, there's a section called the Morphology of Dog Bite Injuries.
What does morphology mean?
It means the shape. And so it goes on to say the anatomy of a dog's teeth is the key to interpreting injury findings. The particularly long, cone-shaped, pointed canine teeth often create sharp-edged wound slits that can be mistaken for stab wounds. The bite mark on the skin is ideally a complete and congruent imprint of the front dental arch. Sometimes only the protruding canine teeth are imprinted. If the shorter incisors leave an impression, smaller skin lesions, parentheses, round pressure marks or streaky glide marks, can be found between the impact points of the canines. In practice, it is hardly expected that all 6 incisors will act uniformly.
I'm sorry, I didn't hear that sentence. Could you repeat that?
In practice, it is hardly expected that all 6 incisors of a jaw will act uniformly.
Is that sentence relevant at all to what you've referenced as an incomplete bite?
Yes,
How is it relevant?
because if not all the teeth impact, then you get a partial bite. You get irregular appearances. There's another sentence that's important here. A gap in the injury pattern can have several causes. Oblique biting, so what that means is not dead center on, but off to the side a little bit. Oblique biting. Curvature of the body surface, which we could have in this case around the arm, the edges of the arm.
Mr. Wu, could you please put Exhibit 1 back on the case? And Dr. Russell, it would be helpful as you're discussing these items if you could determine whether or not what's discussed in that study is at all depicted in this exhibit.
Okay, so we discussed oblique biting, which is off at an angle. Curvature of the body surface. So here we have a body surface that's actually quite irregular. There's curvature down here. There's definitely curvature around the elbow, and so there's curvature around the bones. So curvature of the body surface can change the appearance of the wounds. Interposition of textiles, so that would be clothing.
Is there an example of interposition of textiles in this case?
I don't think so.
Well, was the decedent
Oh.
in this case wearing any, is textiles mean clothing?
Yes, and I
It
thought
was
you
the
meant in this
decedent.
article. But yes, there was textiles in this case. Mr. O'Keefe was wearing that hoodie sweatshirt.
Please
or
continue.
what sweater shirt. So interposition of textiles. And then it goes on to mention some other things which I don't think apply in this case, such as different tooth lengths, tooth loss, abnormal teeth.
And is there any other aspects of that study that are relevant to your analysis and methodology with regard to evaluating the wounds in Exhibit 1?
You know, a lot of this article is relevant, and I don't know if you want to keep.
I don't want to
keep on reading.
keep reading it, but if there is a section, because then I'm going to have a few more questions once you're done identifying the most relevant sections of the article.
Yeah, this. And then there's one section that says.
Thank you.
Yes, thank you. Then it does mention that in some victims, parallel scratch marks originating from clawed paws are found accompanying the injuries.
And is there any other section that you believe supports your evaluation of the wounds on Exhibit 1?
No, I think that's it.
All right, so, thank you, Your Honor. May I approach?
Yes.
Thank you, Dr. Russell. Madam Court Reporter. So do those studies, the de Munich and the Pollock that you just referenced, do they support the methodology of pattern recognition that you applied in evaluating Exhibit 1?
Absolutely.
And do they directly or indirectly support that methodology?
Directly.
And is that medical literature peer-reviewed support or not for your pattern recognition methodology?
So as to the form, Mr. Larson,
Do those studies, each of them, those peer-reviewed studies, support your pattern recognition methodology that you applied with regard to Exhibit 1?
Yes.
Did those studies look solely at individual wounds, or did those studies' methodology look at the overall pattern to evaluate and discuss wounds from dogs?
ask it differently.
How did those studies evaluate wounds with respect to individual wounds and overall wounds? How did the study evaluate those?
They described some individual wounds. There were numerous wounds. Described some individuals, but they looked at the overall pattern to make recommendations.
Was the pattern, overall pattern in those studies important or unimportant in the analyses and conclusions that those authors reached?
Important.
Now let's switch topics. Attorney Brennan asked you about various considerations you made with regard to differential diagnosis. Do you recall those?
Yes.
Let's just start with your differential diagnosis methodology. You describe whether or not you took into consideration additional information that was presented to you in determining whether your initial hypothesis was correct or not. Describe just generally that process and whether or not you took new information and retested your hypotheses. Describe that process that you undertook just generally.
So in general, when a physician is presented with a set of circumstances or wounds or symptoms or whatever, they come up with a possible diagnosis, but have to consider other diagnoses as well. That's what a good physician does. They consider what they think is the most likely, and then they go through a process of eliminating the or including and the other possibilities. Would you like me to give an example, like chest pain or?
Well, I'd like to
pain?
give you an example of what you used here in this case as
okay.
the application of that.
Well, okay, so I'm just describing the overall process because if you came to a diagnosis and narrowed in on it and never considered any other information, sometimes your diagnosis is going to be wrong, and so you have to allow for other information, and so I did that in this case. I examined the circumstances, examined the wounds photographically, and came up with my impression, but I also considered other possibilities. What else could cause those scratches or those abrasions?
And did you honestly and scientifically consider those other possibilities as you continue to review the information, old and new information in this matter?
Yes.
And did that process allow you to avoid confirmation bias?
Yeah. Yes.
So in terms of that process, now let's go through some of the items that Attorney Brennan discussed with you. He asked you several questions, one of which, did you evaluate news clips and audio clips? You remember that questioning?
I remember a question about some news clips.
And did you recall your discussion with Attorney Brennan about acute grief reaction? You remember that discussion?
Yes.
Now, in terms of acute grief reaction, you talked about it, and do you recall discussing that sometimes people who have a traumatic event, that acute grief reaction occurs? You recall that discussion with Attorney Brennan?
Yes.
Now, do you recall also mentioning that sometimes these patients engage in self-blame?
Yes.
And my question, among others, is when they go to self-blame, from your experience as emergency room physician, seeing patients with this, as you discussed with Mr. Brennan, are there instances when patients blame themselves for something when they're not to blame?
Sustained.
Can you discuss what you meant by self-blame in acute grief reaction?
Sustained.
Your Honor, may we approach?
Okay.
Dr. Russell, do you recall questioning by Attorney Brennan with regard to some alleged clip with regard to a motor vehicle, the Lexus and the pedestrian in this case? Do you recall that discussion?
Yes.
And have you reviewed and Attorney Brennan asked you about the slide presentation that what Dr. Welcher did with regard to this supposed accident reconstruction? You remember those questions?
Yes.
Mr. Wilk, if you could please publish the slide from Dr. Welcher's presentation with the arm out in the glass in the back, not that one, the one in this case of the Lexus and Dr. Welcher dressed up as Mr. O'Keefe and with the clothing in the back, but with his that would be toward the back of that slide presentation, probably around 130-ish. That's it, yes. And what slide number is that? 109. So, Dr. Russell, can you see what is depicted on that slide?
Yes.
Is that impact that is depicted on this slide, is that a clip or is that a direct impact to the arm?
I believe that that's a rather direct impact.
Okay, so this is a direct impact. And now, from your experience, and you were asked about this on cross-examination, a direct impact to the arm, assume, as was discussed, a motor vehicle, 6,000-pound Lexus going 24 miles an hour in the reverse with a direct impact on the arm. From your experience as an emergency medicine physician, what type of injuries would you expect to this arm?
So I would expect at least significant bruising, at least. But I would also expect fracture, possible dislocation of portions of the arm.
What portions of the arm would you expect fractures and dislocations?
Well, from this image, if it impacted that section of the arm, and let me use my pointer, right here, a very good possibility that there would be a radius and ulnar fracture of the forearm or an elbow fracture.
Could you please stand up and with your Honor's permission, show where the radius and where the ulnar bones are of the arm? The lights on, please. Thank you. You can keep the lights on.
So the radius and ulnar are the two long bones in the forearm right underneath the skin. And then they join with the humerus bone here in the upper arm at the elbow. And those, of course, these bones are they're susceptible to fracture with a significant impact. And also the elbow would be susceptible to fracture.
How about the hand?
The hand could be injured. It depends on where the hand was in relation. And also, if there was a fall, there are other mechanisms that could contribute to a fracture from the actual fall onto the ground. So there could be a wrist fracture, digital fractures. It depends on the circumstances.
Thank you. And do you, you can be seated. Thank you very much, Dr. Russell. From a direct impact to the arm, as you said, is depicted here. What is the likelihood of there being any fracture to any bone?
Yes. Sustained in that form.
Do you have an opinion, based upon a reasonable degree of medical certainty, as to whether there would be any fracture to any bone?
I believe that there's a very high likelihood that there would either be a significant bruise or a laceration or a fracture of the bones.
Now let's go to, as I understand it, you have reviewed the autopsy report of Mr. O'Keefe?
Yes.
And you've reviewed the file, the medical records files, correct?
Yes.
Is there any indication at all of significant bruising to the right arm of Mr. O'Keefe?
No.
With regard to the lower extremities, from what is depicted here, meaning this impact, did you evaluate the autopsy and the medical records to see what evaluation was done of the lower extremities?
Yes, a very extensive evaluation of lower extremities was done.
What very extensive evaluation was done, and by whom?
By Dr. Scortibello, and it was both an external and an internal examination of the lower extremities.
Let's start with the internal examination by Dr. Scortibello. Could you please describe what type of internal examination she performed?
Well, she opened up the legs.
Sustained.
May we approach her? Or lunch?
Jurors, I'm going to send you a lunch. Okay? We'll see you too. All right, Mr. Alessi, whenever you're ready.
Thank you, Your Honor. Dr. Russell, we left off talking on the topic of differential diagnosis, and more specifically, we were talking about the lower extremity, the leg, and you were mentioning we reoriented to Attorney Brennan's questioning in the area. Could you please describe for the jury your basis of differential diagnosis with regard to the lower extremities and the leg, and specifically with regard to the autopsy's analysis of that area?
Well, the autopsy doctor did a very thorough evaluation of the lower extremities, and to include, the external examination, which is very important, as well as an internal examination of the extremities, the tissues beneath the skin in both legs.
And just briefly, how did she perform that internal examination beneath the skin to look at what was beneath the skin?
Well, to directly visualize those tissues, she had to open up the skin. So she opened up the skin in the legs from the buttocks right down to the bottom of the legs near the ankle, and then reflected or folded back the skin to examine if there were any injuries to the tissues underneath.
Were there any injuries to the tissues underneath from that examination?
There were no injuries that she mentioned, nor no injuries that I saw on the pictures.
And no injuries, did that include analyzing whether there was any inflammation?
No, you can't tell about inflammation, but I specifically looked at the area adjacent to a very punctate little abrasion on the knee, and I looked underneath of that area very carefully on the photograph, and there was nothing, no injury underneath, no bruising, no hemorrhage underneath that abrasion.
With regard to that, how did you describe that punctate? I want to make sure I got it accurate. By the right knee?
Abrasion.
Abrasion. Could you determine from that even the age of that abrasion?
I could not.
And no further questions at this time, Your Honor.